There are several ways to categorize what happens to a joint after a trauma. Sometimes they can be subluxated. And subluxated means that the joint is slightly out of alignment. It'd be like my hands, just slightly moving. But also, if it's more than a subluxation, it can be a dislocation, where the joint, instead of sitting on its normal plane, comes off and actually falls out of where the joint's supposed to be. So what do you do for dislocation? Number one, get that thing reset as quickly as you can. Ideally, you want it done by a professional, someone who knows what they're doing, because you don't want to create more damage moving the joint back into a normal alignment and pinching things in there. Also, afterwards, you're going to want to ice that joint because it's so traumatic. You're going to want to keep ice on it to keep swelling down and help with pain control. There will very likely be some pain medication that you'll be wanting depending on the size of the joint. Oftentimes fingers, no big deal, right? If your finger dislocates, it moves back in. Even if you just pull it a little bit, it's going to move back in, and then it's just going to be sore for several weeks. But